And I'd like to bring up our panel, but before I do, I'm going to introduce them and give you a little bit of background. We're very lucky to have a really, really great healthcare panel today. Karen Van Caulill is Executive Director of the Health Council of East Central Florida. She's got a Bachelor of Science from Duke, a Master's from University of North Carolina, and a Doctor of Philosophy degree in Public Affairs. She's worked in health planning for 25 years. She was the first project manager for the Orange County Primary Care Access Network, sometimes called PCAN. She moved to the Health Council in 2002, and the council facilitates and coordinates health planning for 4 counties: Orange, Seminole, Osceola, and Volusia, I believe it is. Brevard, forgive me. She speaks on health issues locally and nationally, and she was awarded a 2009 Community Services Award for her volunteer efforts to reduce health disparities. Her office is in Oviedo, and she lives right here in Winter Springs. We had a substitution today because our originally scheduled speaker, Tony Jenkins, who is the market leader for Blue Cross and Blue Shield of Central Florida, has a brother who is in hospice, and he had a call to go up there. So he has sent a wonderful substitute, and that is Dave Santa, who is Director of Sales for Blue Cross and Blue Shield of Florida, rather. And Blue Cross and Blue Shield serves 8.6 million people throughout the state. Y'all come on up here as I call your names, please. He is active in the community and serves on the has served on the executive committee of the Seminole Regional Chamber of Commerce. Senator Andy Gardner is Director of Community and Business Relations at Orlando Health, but of course you probably know him better as the senator from the 9th District. He is the Majority Whip in the Senate. For 8 years before he joined the Senate, he was in the House of Representatives. There from 2000 to 2008, he was Majority Leader from 2004 to 2006. He's on a zillion board of directors, including the Valencia Community College Foundation, Central Florida YMCA, Boy Scouts of Central Florida, the Orlando Museum of Art, and I could go on, but I'm not going to. He earned a Bachelor of Science degree in Political Science and Psychology from Stetson, just around the corner. Karen Bowling is CEO, come on, co-founder and president and CEO of Solantic Walk-In Urgent Care Center, the largest operator of urgent care clinics in the state of Florida. Solantic has 24 centers, and that number may be a little bit lower than it really is.
It's 27.
It's 27.
It should be 30.
Okay. In North, Central, and South Florida and the Treasure Coast, including a couple of destination sites in Walmarts, and they just opened one in the Orlando International Airport. She began her career in television news in Jacksonville. She moved to healthcare marketing and management with Memorial Medical Center in Jacksonville, and then joined Columbia HCA at their corporate level when Memorial became part of Columbia HCA. Prior to starting Solantic, she was Vice President of Marketing for the Health Network, an around-the-clock health and medical information cable television network owned by Fox Entertainment. She is also very active in the community and works on several boards in Jacksonville, Board of Directors from the Jacksonville Humane Society, the American Heart Association. In March 2009, Jacksonville Business Journal selected her as an ultimate CEO, and honestly, I'm really abbreviating all of their introductions. Suffice it to say that we've got a powerhouse panel up here, and each of these panelists has a unique and different perspective on the current healthcare system. They also have a lot in common. They are in the trenches every day with the business side of healthcare as well as the people side of healthcare. And I can tell you that everyone up here probably wakes up every morning and wonders how they can make healthcare better, how they can do a better job. So like us, who are business owners or consumers, we are all watching the healthcare reform debate with much more than just, kind of ordinary interest. This is a very personal issue for each one of us. The Government Affairs Committee suggested that this would be a good topic, that people have a lot of interest in it, and so that's what we're trying to do. Today is about educating ourselves. Where are we as a community? What kind of health care services do we have? How do we compare to other parts of our state, other parts of the nation? And what changes might make sense? And discuss what health care reform might look like. Each of our panelists will start with about a 3 to 4 minute overview of their piece of the healthcare puzzle, the current healthcare landscape, healthcare insurance and the uninsured, the roles of hospital and government, and non-traditional consumer health-driven healthcare alternatives. I'll have just a few questions, and then I'll let you have questions, because I know that's what you came here for. We'll start with Karen Van Collill. We will move to Dave Sana, Senator Gardner, and then Karen Bowling.